Yes, hello, good evening. How are you? Welcome to another session of Ask the Doctors. How you doing now? Happy Sunday. The time is the time is 8 p.m. here. How far? I hope you can hear me and you can see me. Where are you watching me from? If you know you can hear me, I need you to tell me where you're watching me from. I'm live on Facebook, I'm live on YouTube, I'm live on Instagram, and I'm also live on TikTok. Yes. Now the thing is that on today's program, we'll be having a question and answer session. But before we start, I just want to wish a happy International Women's Day to all the wonderful women all over the world. A happy International Women's Day to you. I celebrate you. I celebrate your strengths. And let's see. Yeah. So I did live on Facebook, I did live on YouTube, I did live on Instagram, and I did live on TikTok. Somebody's watching me from California. How far now? How is California? Yes, my people. Where are the TikTok people now? The TikTok guys are here. They see you. They see you. The TikTok people. How far? Okay, ma see my somebody be they watch me for here. Who be this? Who they? Okay. Let me see. You just they enter here. Next thing now question you they ask me. You don't even say hello. You don't even say good evening. Nothing. Now so you they do your own. I'm not there with you. Yeah, how far? Why this Instagram live did you like this? Blessing, I see you. Blessing Cynthia, I greet you specially. Good evening. How you doing? Oh yeah, tell me, where are you watching me from? My people on TikTok, you know, so you don't see why I do TikTok live. Uh-huh. How far? Where you watch me from? Let's see. Hey. Okay, good. Thank God. Yes. Oh yeah. Oh. So in case you dey watch this video, you won't ask us for treatment. We not go give you treatment for here. If you dey find diagnosis, we not go give you diagnosis here. If you dey find medicine, we no go give you medicine here. You go hospital. You hear me so? We no dey give anybody treatment here. But anything we no dey clear to you and you want to ask, feel free to ask. And if we know the answer, by the grace of God, we will answer you. If we don't know the answer, no response. Yeah, you're watching me from Netherlands. How far now? Hard aside. No hurry in life. Okay, watching from Ikorodu, Lagos. Yeah, hello. Mommy Monisade. How are you doing? Happy Sunday, ma. Hi from Chad. Nice. I'm watching you from Enugu State. Enugu State, nice. From Maryland, United States of America. Who be this? From Sierra Leone. Musa is watching me from Sierra Leone. Please, is cefizim good for typhoid? Who told you you have typhoid? Answer me. Answer me. Who tell you say you get typhoid? Hey, my chief is in the house. The double doctor, Dr. Matthew. Twale for you, sir. Yeah. Lab results. Now listen to me, you. I think we have been too nice. My guy, you know, get typhoid. Lab results, not be typhoid. Go hospital, see doctor. Doctor go tell you, say, my oga, this one. Go and do this test and come back. Why is not test for typhoid. You dey hear me so? I don't tire for this thing. I don't tire for this thing. From Imo State, Wydal is not test for typhoid. Wydal is not test. I greet you, sir. It don't tire me. And I dey see some laboratories still they do Wydal tests, and it's surprising, From Sierra Leone, yes, I greet you. Hi, Sierra Leone. Working from Walter Smith. Where is that? Where is Walter Smith? My guy, Wydal is not a test for typhoid, so you don't waste your money. This person talk say you no answer me. You enter live session, you know sabi greet us on the live session. Oh, you enter, we dey greet you good evening, you no answer us. Where are you watching from? You no answer us. Happy Sunday to you, you no answer us. The next thing na question, answer me. Abi, because I sit down for live session, answer me. We greet you, you no answer us. Oh, happy Sunday, you no answer us. Oh, where you dey watch us from? You no answer us. Oh, happy International Women's Day, you no answer us. Oh, next thing, answer me. Abi, okay, nah, I see. Let's see. Let me see. Good evening. I greet you specially. Good evening, Olalekan. Sup, Rujuku. Oh, it's true now. Come on. Faith. I greet you. I see you. Such an insensitive man. Some of una they supposed to carry your brain go beach, wash your brain with soap and water. Hmm? For the fact that we are on the live session does not give you the right to just jump and start asking. Courtesy demands that you even greet the people watching us. You just enter live session, next thing a question, and you saw that when I started, I said, good evening, how are you? Happy Sunday. Where are you watching me from? Happy International Women's Day. You ignore everything. I greet you, I salute you. You see me, I dey greet everybody here. Or I know they claim to be anything. When I come, because I have people who senior me well for here. I dey greet them. I dey loyal. Can I ask? Please go ahead. Ask your questions, please. Good evening. Watching from Lekki Phase 1. Open. Lekki Phase 1. How far now? So today's program is a question and answer session. Happy Sunday to you. It's an open day. You can ask anything, but remember, we don't treat here. We don't make diagnoses here, and I don't prescribe medications here. You would have to go to the hospital and see your doctor. But if there's anything that is not clear, if there is something you want me to throw more light on, and I know the answer, I would respond to you. Is that okay? Please go ahead. Ask. Please go ahead. Good evening. Please ask. Please go ahead. Yes, I see you. I see you. I'm happy to be on live stream with you. I'm watching from Punjab in India. Oh, what is the time in India right now? Tell me. Go ahead. Ask your question. Ask your question. Oh yeah. Ask. Oh yeah. Oh, ask me. Ask me. Let's see. Let's see. Let's see. I'm checking for your questions. I'm checking so that in case I see them, please tell them to reduce their voice. Thank you. Oh yeah, go ahead. Ask a question. It's 12:39 p.m. in India. How many hours is that? 12:39 p.m. That means we are ahead of you guys with about eight hours. Yeah. Okay. Oh yeah. Oh, let me see. What do I want to say again? And get one video. We have a live talk about. But I noticed that anytime we're having a live session, good evening, Sweet Berry. Hi. I noticed that anytime we're having a live session like this, people know they ask questions. But when we start talking about one topic, they begin to ask you something that is not related to the topic. So today that is open day, ask. But if you know, ask me, I go just the gist randomly, yeah. uh I go the gist random gist. Um, Up the one now. Please, my wife always complains about headache, and anytime it comes, it's always severe. Please, what could be the problem, Mr. Henry? There is no way. Happy love, how far? No, no, put on for two. Yeah, leave it like that. So Mr. Henry, there is no way anybody can tell you what is happening to your wife online. Your wife definitely needs to see a doctor so that we find out how long the headache has been, what part of the head, what are the triggers of the headache. Um, you understand? Find out if she has anything that relieves the headache. Find out if she has other symptoms, if she has eye issues, if she cannot see clearly, if she's having neck issues, if she's having dizziness, many things, if she's losing weight, if she's coughing. These are the things your doctor will have to check at the hospital. There is no way, sir, we can tell you why your wife is having severe headache online. After discussing with you and your wife, your doctor can decide to recommend different types of investigation. Yeah, as long time. How you there now? So, Mr. Henry, there is no way anybody who diagnoses your wife online like this, the person is a scam. There is no doctor, no licensed medical doctor will tell you that if your wife is having headache, go and give her this medicine. They want to destroy your wife's life. So please take her to the hospital and let a doctor see her. Take her to, if you can, to a teaching hospital. From the way you have described this, I think it's something that is serious. Huh? Okay. Share this live session. Share the live session. Happy love. Our family now. How that side? I hope you are good. I hope you are safe. You are in Israel now, Abby. Yeah, yeah, yeah. Share this video. Um, Doctors no get crystal ball wey dem go take know wetin dey happen like that. It's true. We are not magicians. We are not soothsayers. We no be spiritualists. No. To avoid anybody tampering with your wife's life online, take her to the hospital. Infection fit cause may woman no fit get pregnant. Okay, I like this question. So my response, I'm not going to say yes or no. You know why? If I tell you yes now, the next thing be say any lady wey get problem, maybe in an infection, e go affect her pregnancy. Plenty things dey wey fit make woman no get belle. Plenty. Number one of them fit be say the woman no dey even knack. The woman no dey meet her partner at the right time. I get people wey don tell me, oga doke o, I dey try get belle o. When you go ask the woman how many times you and your partner dey knack, you go say my partner dey for another country. E dey always come once in a year. But I dey find belle. How you go take get belle if you no dey chook gbola for inside kpekus? You get the point. Now, there are other things as well. It might even be from the man. It might be hormonal issues. It might be stress. You get the point. It can also be an infective condition, but that one a long process. So you know, if you just sit down and say, "Hey, infection go make woman no get belle," e possible, but no be dey common like that. You hear me so? Because Africans don carry am for head say the moment woman no get belle, the woman don do something. Maybe she get infection, this and this. Sometimes e fit even be say na the man get problem. E fit be say na the man. Sometimes dem no dey even knack. How you go dey find pikin, you go dey wear pint sleep for night? You get my point. I'm not trying to say una no dey knack. I'm just trying to help you understand. In medicine, we dey careful with the way, well, I don't know about other people. I know some of my guys, we are very careful with the way we respond to certain questions we see online. Make you no go make man and woman go dey fight for house. Okay. Yeah, Chief, thank you for sharing. Everybody share, share, share. Good evening, doctor. My name is Gogo. My wife always complains that she's not seeing her menstrual flow getting to 2 years because of the family planning she took. So talk, what can I do? The both of you should see a gynecologist. 2 years is quite long. And the both of you should see a gynae. Uh, you and your wife, make una go hospital, make una see gynecologist. Sure you get. Yes, it don't too say. If it dey possible, say the family planning, if you don't make her hormones do one thing or the other. So please see a gynecologist. Yes. And Dr. Fred, let's see. Somebody says, Dr. Fred, hope you are good now. Yeah, yeah, I'm trying to be better. I'm trying to be better. Um, okay. Let me see. Let me see. Let me see. Wetin dey make woman born pikin, the pikin go die at the delivery room always. Wetin dey make woman born pikin, the pikin go die at delivery room always. This question na very sad question because e no suppose to dey happen. E no suppose, somebody no suppose to dey ask this. E means say there is problem, and this problem is coming from so many areas. Number one, if you be say the people wey dey handle this delivery, dem no dey communicate to una, something dey wrong. Because if woman don carry belle up to time wey she suppose to born the pikin, nothing suppose to make that pikin kpai for delivery room, most especially if e come be always. So the answer to this question e plenty well well. Where this woman dey do the delivery, where she born this pikin, her hospital, who dey handle this delivery, at what time she dey handle dey born this pikin. This woman dey go for antenatal, because this question is not supposed to come up at all. It shows that there is a breakdown in care. Very big problem. It's a sad question. I'm not gonna lie you. Because for somebody to ask this question, me say something don happen. You born the first one, buy for the living room. The second one is supposed to buy. So I beg you ask this question. Tell us more, because we cannot just give you any answer. Wetin dey happen? Una dey go for hospital, na doctor handle the delivery. You understand? She go for antenatal because wetin dey cause this thing na problem with labor. Is it a traumatic labor? Is it obstructed labor? Which dey happen? This one no be nice stuff. Dr. Israel is in Oh my God. I hope you can see me now. I don't tire for this bad network. I don't tire. Dr. Israel, have fun now. Hello. Can you hear
Oh
me?
my God.
Yeah, I'm back. I'm back. My network is messing me up really. My network is messing me up. Let's see. Hello? Alpha,
I
can
do.
you hear me
Welcome
now?
back.
Yeah.
Yeah, I
More
can hear you.
network. Okay. Thank you. Welcome. Happy Sunday.
Same to you.
Uh, okay. So I have family now.
Ah, they are fine.
Okay, good. Now I want to believe that our people they hear us, Abi. Waiting be the reason. Let me see. I want to be sure. I want to be sure that they can hear. If they can't hear us, then wow, good. Um, if you can hear us, just say yes. I can hear you. Oh yeah, let's go. I want to be sure. I know you can hear me, Dr. Israel, but I can't see any comments again. So the matter now can't get a CB. Yes. Ah, okay. Oh, wahala be like bicycle. I can't see any comments. Okay, so what we're gonna do is what we're gonna do, Dr. Israel, I go exit. I go exit and boy you go. I don't know. I'm not seeing any comments. So the matter get as it be
Okay,
right now. Let me
make me
see.
ask if they
Okay,
hear
yes,
me.
I can hear you now. Okay, okay. Somebody say yes, I did hear
Okay.
you now. Okay, yes,
Okay.
yes. Okay, good. So let's be fast because of time. We don't taste more. Somebody says, he say, my question is, it's happened to my colleague. He was experiencing a flow or emission of white slippery fluid from his penis, and we don't really know what could the issue with him. He was 25 by then and a celibate. He never knocked. Please, what could be the problem? Dr. Ejola, beg, answer, beg.
They say 25 by then. Me say this person don't pass that 25 and maybe the thing there will stop. However, if it was happening, there was no problem. He just dey show say yes, the person can do things. And you may not you may be you feel say he never knack, but in mind they think so many things. So when they think so many things, he can actually have those kind of uh ejaculation or those kind of fluid coming out from the body because of what and wetin they pass through in mind. Yeah, wetin they pass through in mind. Sometimes you may even have a word dream, maybe for night and all those things. So one, of course, of wetin they pass through in mind. So it's not something, not be one thing where you worry about. Yeah, not be one thing when they worry about. As far every other thing they normal, if you peace, no pain, there's no fever, no problem, not be problem. Dr. Fred.
Okay, yes. I hope you don't hear. Yes. Let me see if we have another question again. Watch both legs for almost half a year now. Gree go back. Please, what can I take for ringworm?
Okay, firstly, we not dey give person medication for here. So we're not going to even tell you, we not go fit tell you what you go take. But what I can advise is make you go hospital. Yeah. If you go hospital, they go check those ringworm. If you know you'll be ringworm when you think, maybe something different from ringworm, They go check and then they go give you the correct medication. Maybe you've not been getting the correct medication. I never can tell. They fit even ask to do some investigation. Maybe say now the investigation go come make them know the drug when they go give you. And another thing, if your hygiene level is low, please you need to increase them, because if not really ringworm still dey, because those things now like fungal infection. And if you know, if your parasitic and all of them infections. But if you know, if your immune system not, sorry I say if your hygiene is not too good, sometimes you start having all those many things. So you also need to watch your hygiene. You also need to wash your body. The towel where you they use for that leg, if you not use them for another part of your body, you also need to change some things. Maybe change your towel, change your soap, change your what you are using. Sometimes those things you may just need say now when you change one or two things, now they start to happen. Until you change them back, they may not stop. And so those are just some few things. But as far as you say, don't take, go hospital so that may you get the correct medication. Sorry, we don't give medication in this place. Dr. Fred.
Yeah, Dr. Israel don't answer your question. Hmm? You gonna need to go hospital, make them check you. But most times, some people will get this ringworm. Now, them they treat themselves, and they never enter hospital. And then they will also want us to continue the treatment for them online. So you gonna need to go hospital, and then give you medicine. Okay, ask your questions now. I want to believe that you did hear me, but if you know, so you know they hear, let us know. And does gastritis weaken sex performance? No, sir. No, now. Gastritis not the weaken performance now. No. But by the way, what do you mean by weaken performance? Because many people get gastritis, they affect, there's no relationship, there's no correlation, connect at all. Hmm? uh, Unless maybe now your mind when you dey reason gastritis psychologically, now they make you know they feel perform, but it not dey cause weaken performance, or maybe I don't know, Dr. Israel, it dey affect performance.
No, no, to the best of my knowledge is no. So except maybe you get some other medication when you they take or other things when they do. But no.
Hmm. Okay, so you don't hear the answer. Yes, so we see they wait for your question in case you just dey come. And this now Ask the Doctors program every Sunday by 8 p.m. to 9 p.m. Today, now question and answer we they do. So if you get question for us, drop out. But not be every day we dey do question and answer. But today's program, now question and answer. We won't answer your question because next week Sunday, we no go do question and answer. We go talk about topic. And we notice that whenever we dey talk for one topic, some people go they ask us question we know they related to that topic. Now make us say, okay, sometimes make we they do question and answer so that you can ask us uh, anything we want to ask us. So use today's opportunity to ask us any question when you get. Ask now. Ask now. No, they wait. Hmm? Okay. Dr. Israel, I'm not seeing any question here. Sir, you didn't
Malik
answer
say in
that
get
my
question.
question. No. Drop the question again. Drop them again quickly. Time not there. Let me see. Time not there. I know see you for YouTube again. And those we not get time. Yeah, drop and now. As it dey hot. I see you, Epic Tales. I see you especially. Alpha, how you day? Good evening. Okay, nobody they ask us questions. This the last question we get for here. They talk about gastritis and weakened performance, and we just told you there is no relationship. Gastritis, now the stomach area, the gastric mucosa, connects to your performance. Dr. Ezra mentioned something. Maybe you dey take medicine, maybe medicine wey you dey take, maybe na im dey affect you or something else, but gastritis uh has no business with your performance. Doctor, sickness might not kill me, but anxiety, how can I do away with anxiety? Dr. Israel, you fit respond to this.
Okay, anxiety, when it can become a problem, it's like it's a sickness, it's a mental health disorder. Yeah, so it's a mental health disorder. The only way you can do away with anxiety is to visit a psychiatric doctor or a psychologist. So you guys will discuss. It will give you some. It will take you through some series of sessions on how you take manage your anxiety. So one of it now, it will teach you how to take deep breaths. That will also help you to calm your nerves, calm your brain, calm you down. So when you see something when it's supposed to make you anxious, you take a deep breath, breathe in, breathe out. You can even breathe in and count 1 to 10 or count to as many number you can count. Then you breathe out. If you do that for some time, severally, that anxious attack at that moment can actually come down. So, as I said, anxiety becomes a problem when it disturb your daily activity, because normally everybody they anxious at one point in time. Everybody get am. But now when it comes turn problem, when we say it disturb your daily activity or it disturb your work what you supposed to do, then it becomes a problem. And when it don't become that kind of problem, it may say you need to now see a psychiatrist or a psychologist, so that may they take you through some process. Another process now be the yeah. If now maybe now something that they make you the day anxious, you need to give yourself positive affirmation against or about that thing. Yeah, so that make that fear for come out, because anxiety go with phobia and all that, so that fear will come out with those positive affirmation, with the breathing practices, all those things. And those two things when go fit help you reduce your anxiety. However, you need to see a psychologist or a psychiatrist. Thank you.
Thank you so much,
Dr.
Dr.
Fred.
Israel. Can you hear me?
Yes, I can hear you.
Okay, good evening. Yes. Okay, like if the woman get belle, the child go die in her womb. This thing happened like 3 times. As doctor, wetin fit dey cause that kind thing? Ma allow Dr. Israel answer you abeg. Oh yeah, Dr. Israel abeg. He say
Okay.
about IUFD.
This question don first day up. I even think say this question first day up. I first say I think say you don't answer am already.
So the
Okay.
first one wey he
So
ask, no be like this he ask am. He say the woman born and
now
the pikin die after the woman born. He don always now he say the pikin dey cry inside belle.
okay, now almost the same thing. Now almost the same thing. Because if the pikin don dey form already and e can't die, they can't born and you turn stillbirth. Now still almost the same thing. Then, but firstly, the first question will come be which time for the pregnancy the pikin take dey go. Is it the first trimester? Is it the second trimester? Is it the last trimester? Most of the time, if now death during the first trimester, when your blood is not miscarried, those one fit be chromosomal issues. The body notice say this thing, this pregnancy not the form where e go remove am. Then if now the second trimester or even the third trimester, sometimes if the cervix not go fit hold the pregnancy, e go come out. Yeah, the thing fit there. Another one, sometimes if it be say the woman get malaria fit cause am. If it be say e get some infection for inside body, e fit cause am. Then the most commonest one, the one wey come be another problem, now wetin be the blood group and genotype of the woman. If the person get blood group O A B or B, I can't carry that sign when they call negative. It will not be positive. So in resource is resource negative. So that kind of woman now go they get all this kind of pikin. E get belle, pikin die. E get belle mostly when the pregnancy don't go far, don't almost reach third trimester, don't almost one borner. So that one na when that one they quick happen. And another one are just that nobody knows. It just happened. Yeah, it just happened. Then another one are some kind of medications when people they take during pregnancy. Some go take so many different kind of concussions, some go take some kind drugs when maybe na still doctor maybe they still go buy them for pharmacy when they take when they're not supposed to take during pregnancy. So when you take some medications when you are not supposed to take during pregnancy, if it cause kpai, if it make the pikin come out, or if it make the pikin kpai for inside belle because of those medications. And as I said, one of the major one is the resox factor, and which will actually cause that. So that when the pikin come out, you can't say now some go you just if you see yourself, you'll be amazed and you will not be happy to see such thing. So for that kind of person, he need to get a gynecologist. He need to get doctor when they specialize in women, when they treat women. You need to get one when he go follow discuss. They go do some investigation for round, check him womb, check his blood type, check everything, try to understand even your moon, check everything. Then they go start to the monitor am. If na resource wahala, they know wetin they go do when go stop am. If na maybe the woman I go take medication wey not supposed take, they go also know and still try to correct am. If any other thing, they go know. If na the one wey be say we go dey wait to dey pray say nothing go, all of us go dey wait. Why some they go need to bring out the baby even before the time when they notice say once the pikin reach so time and the pikin take the kpai for belle, they go make sure say they bring out the baby before it gets to that time, so that make the pikin for no kpai. Yeah, make the pikin for no kpai. Yeah, that's say you said on the last trimester. So make the pikin for no kpai. So now so it dey be. And so it dey be. Dr. Fred.
Yeah, thank you. I hope you can
Dr.
hear me,
Fred.
right?
Yeah, I
I
can
hope
hear
you
you.
hear me. Okay, good. Somebody says, is
Yes.
there any effect that can come with abstinence from sex for a long period of time, since the process of spermatogenesis is active daily and maximally producing 200 to 3 million cells each day? So the effect is that your body will take care of all those productions, you understand? And through the process of what we call apoptosis, since we dey use spermatogenesis for us, make we also do small this thing. So your body will take care of that. There is no effect at all. Yes, we have seen researches and it's ongoing that says as a man, you would benefit more if you ejaculate more frequently, 21 times. Studies still going on, but it's not yet conclusive. You will benefit, you would reduce your risk and the whole stuff. But that does not mean that if you don't engage in intercourse, then you will come down with sickness. No. No, you know they. Dr. Israel, you want to add anything to that?
Okay, the question when I want to ask, when you know when person they grow they come. Yeah, when person they grow they come. And when it start to they mature, all those things start to they form, all those spermatozoa and all those things start to they form. At that age 15, 16, 17, some people never knock and they go take them like 4, 5, 6 years or 7 years before they even think nothing has happened to them. So nothing will happen. Yeah. As Dr. Fred talk, the body always know how to take care of things. So it will also take care of it.
Thank you. We have a question here. I have a prostate cancer patient whose testicles have been removed and is still on bicalutamide and some other medication. He's skeptical about taking chemotherapy drugs because of the risk. He says what there is also another drug the doctor recommended, though very costly. I don't know the name of the drug. Do you think it's safer and maybe more effective than chemotherapy? The patient is largely stable. Look, I allow Dr. Israel respond, I beg.
Okay, Dr. Fred, you dey hear me?
Yes, I can hear you. Yes, I can hear you. I can hear
Yeah,
you.
we know how chemo does this work. Okay, we know how chemo does this work, how chemo to the react and how chemo to the work. Now, I think it is very good, and it is very important for.
I can't hear Dr. Israel. Am I the only one? Hear Dr. Israel. Okay, yes. Dr. Israel don't come out. I thought as much. Okay, so your question is about, first of all, the patient is stable, the patient is on medication, and now for recommendation of the chemotherapy, what are they trying to achieve? What was the stage of the prostate cancer? Remember, uh if it was at the early stage, maybe the stage one, it has not metastasized, and they took it out, you can make a decision. If it has metastasized and they are thinking or they are suspecting, they might also recommend chemotherapy. Yes, we know some of the side effects of chemotherapy. However, the decision to go for chemo or not to go for chemo, I can't really make that decision. I can't say because we don't have more details. But most times, the doctor might want to prescribe that because they are also thinking of maybe there where or there are metastases. So they're trying to, okay, it's back. They're trying to go after it. Dr. Israel, oh yeah, yeah, welcome back. Hello.
Yeah, I'm with you. Did they hear me?
Yeah, yeah, go ahead, go ahead.
Okay, so as I was saying, I was like, people, we know how chemotherapy take dey work, how it take dey react, and how it take dey damage a lot of cells in the body. But we also know what cancer can do to the body. So I think uh, even those medication when you say that they give and this, if you look am very well, you will be surprised that they have some element of chemotherapy inside them. So I think the best thing for that patient, now that he's still very stable and strong, yeah, now that he's still very stable and strong, I think it is better for him to go for the chemotherapy now that he's still strong. Because if he don dey weak, he can't go. If he become something else. But now that he's still strong, that he can still do so many things, I think it is better for him to go for the chemotherapy so that make everything for comot immediately. Now they did the surgery to remove large amount of to remove a lot of the issue. So the chemotherapy is to clean the rest. Is to clean the rest. I know say when they do that, the reason why they do that they remove the testes na because you know when you produce sperm, you can't go stay for the prostate and all that. So then we want to make all those process stop. And that's drug wey they give am na to also make sure say all those process stop. But the cancerous cells, na those chemotherapy na go take care of am. Yeah. So e need, as far the e still dey within that process, e never, I hope e still dey within that process. E never go, the stages never too go far. E better make you take care of am now with the chemo so that it will be fine. It will be completely fine. Because once it don't pass as be careful, he may not be able to do anything. Dr. Fred.
Okay, I believe you heard epic tales. I hope you heard the response from Dr. Israel, and uh, you saw his own take. Before he came up, I gave also my own take. Huh? uh So I hope you can now make a decision. In addition, you should be discussing with your doctor as well, and the doctor should also carry you along. They should explain the reasons why they are also thinking or introducing the chemotherapy. These things are not hidden. You can have this discussion with your doctor. Very important. Um, okay, if person they complain, say im manhood no dey function proper when he dey with im wife, but e dey function proper when he dey with another lady, wetin fit cause that kind one? No vex on my question, abeg. No, I no vex. I no fit vex. Okay, no be bad question you ask. Oh, now in for normal life, e get wetin we dey call see finish. I mean say see finish so that you can relate with. But also you are now used to your wife. You are used to your wife. Your wife no dey, dey make your brain spark, scatter. Eh? You don dey oversensitize. You don see am, see am, see am, see am every day. But the one wey dey outside, you never see am before. You no know am. That part of your physiological response is still new to that one. So your body is seeing that like a stranger. This one is a part of you. So as now a part of you, it will now need you to do more work to arouse. It no mean say you dey sick. It no mean say you get problem. But now what they call is like you are physiologically oversensitized. You don't see your woman back to back, back to back. But the one with the outside, where you never see, that one, a part of your brain has not been sensitized. Now they make you they feel as if say your manhood they respond. You get my point. It's not a sickness, it's a normal process, and you have to now work on yourself. Because if every time you they follow different women, by the time you follow that new one outside, after you go see that one finish, you go they oversensitized, you go meet another one. How many you want they meet? Do you get my point? So it's not an excuse for you to they make your manhood they stand up and down, but also it doesn't mean that you have a problem. This now means you have to work on yourself psychologically. So if you want to add anything to that?
No, you don't already talk the part when everyone the psychological part. So you don't already talk, so you need to work on yourself psychologically. So there's nothing else so far.
Yeah, it's important. Yeah, and because now that psychological part will come put you for trouble. You get the point. If you don't
Yes.
control the psychological parts, now that one will come put you for problem. The other ones no go put you for trouble. You know me say you dey sick, no. But if you know if you control this mental parts, make I no lie you, problem will happen to you. Okay. And this is a very good question, by the way. You know me say you get problem, and a lot of men don't go through this, so nobody will laugh you for asking this question. Yep. Okay, let's see. Do we have any more comments? We are almost out of time. Is it clear to you, sir? Do you understand? Please make me know that you got all our responses. Oh yeah, oh yeah, oh yeah, oh yeah. No time. If you never share this video, I wonder why. What are you waiting for? Why haven't you shared? And why haven't you shared? Yeah, it's like now me they enjoy this life pass. So my brother, now so you be. Oh. Everybody they observe you, they don't want to ask. The moment we are done with the live session, you start hearing, Doctor, please now answer me. Doctor, I want to call you. They don't make good use of this time. And the truth is that we don't get time to follow everybody chats online. We don't get that time. Now make us they make out these live sessions to respond to people. So keep asking us and we'll respond until 9 p.m. So Israel, you get anything to drop for this program? Anything at all?
Not really. I want to just for today. We know say our network actually we want give us small hint, and but we are glad say we still fit do the program very well. So make I think everybody should just take care of themselves. And if you notice the weather is very, I don't know for whether not everywhere, but for those of us when they stay Lagos, you notice that the weather is very hot this period. Uh, so I beg more try to dey take a lot of fluid this period. As Dr. Fred talk, so many questions when people will need to ask. If you this is the best time to ask. This is the best time to ask because it's get the time when you go you get some question where we go even see for our WhatsApp or sorry for our Facebook status. So make we just
Okay. Dr. Israel network, like say network don't start today act up. I don't know what happened. But before we go, um I need you to share this video. Share this video. Share the live session. Doctor, is it possible for somebody to develop prostate cancer at a young age? Okay, it's possible. It's possible, honestly, it's possible, but it's not common. It's not common. Prostate cancer is actually common in elderly men. So if a young man they complain about prostate issues, nobody go they think of prostate cancer because they common at all for young men. But that does not mean it can't happen. If it happen, uh but they common at all. Now people with the elderly, now they get prostate cancer more. So if young man they get prostate issues, we know the first of all think of prostate cancer. Thank you so much. I will try to convince him to go for the chemo. I hope he obliges. Yes, yes, yes. Okay. Doctor, please. Oh, I used to masturbate during my young age before I later realized what I'm doing. Due to the constant rubbing, my manhood, then I noticed it has cost it small. It has what? Cost what? I don't understand. It has made your manhood to be small. Is that what you are saying? Please, any solution? I'm now ashamed of the size I get now. Make I allow my oga respond to you. Oh. I want to assume he understands your comment. Dr. Israel, I beg.
I'm not sure understand again. It say it's more and well, I don't think that can cause that for you. Yeah. I'm not sure say because of what you do, it go fit cause your size to come small. And it's not possible. I think that na your physique, that one are you. And also I need you to understand this. It's not about the size, it's about how you take use them. Eh? That's what matters. So it's not about the size. Some people get on like 22 inches or 30 inches. They're not if use and do anything. It's just big for nothing. While some people get on small, but once they start, you'll be like say the word won't come down. So the most important thing is how do you use it. It's not the size that matters all the time. And also make sure say if your partner not they complain, I don't see any reason why you should be complaining. Yeah, if your partner they complain, you should not complain. Uh, so I think first of all, you need to build that confidence in yourself and build that confidence in your guy. When you don't build that confidence for yourself and for her, he himself will come start to dey work like who he supposed be. So no body shame am. Nobody shame and leave the guy as he be. And as I said, that is not the reason. It's not because you first of all do those. It's not. That's not it. Eh? Not being because the size. Dr. Fred.
Thank you so much, Dr. Israel, for this response. Thank you. Now it might be one talk with that, but just to save my energy. So maybe we try a round up, eh? I don't know that you get any final comments for our people as they watch us right now.
Some the same one question. I don't understand that. Moses Freeman.
It's just the answer right
Yeah.
now. I'm just seeing it now. It says, good evening. Sorry. I want
Yes,
to ask
just
you a
the
question,
answer.
please. If someone mistakenly his blockers and the blockers, oh, blockers, and the blockers is paying the person and also swallow, which kind job? I know, okay, oh, Dr. Israel, I don't know this one. No.
Okay, heat in blockers and the blockers is pain. The person and also swollen is swell up. Which can Oga, carry yourself. I even think I never read and finish person before.
Okay,
Okay,
swollen.
firstly,
Okay, and
let's
also
assume
swollen. Okay.
swollen, yes. Uh, let's assume that Moses B. Freeman, let's assume say you know they follow us or you never enter our life before. One of our rule is that we don't give medication to anybody in 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 social media. If you need medication, go and meet your doctor. Go to the hospital. So if your blocker swear and they pay you, and you see sit down for us, now me say e no dey pain you. If your blocker swear and they pay you and they ask for drug online, it simply means say e no dey pain you, because you cannot have that kind of complaint and be sitting at home. Person wey get that kind of complaint, if he slap person, based on what they even teach us about blockers they pay you. So I will advise you, except maybe the pain not severe, I will advise you to go to the hospital, because you never can tell wetin dey make am dey swear. They feel not because you hit am, fit be something else. So you need to go to the hospital, make they examine am, make they see the swelling, make they understand wetin dey cause the swelling, and then they go know if na medication you need or if na something else na you need. So I also want to use this opportunity to tell you and every other persons that going online, coming to social media and be looking for medication is not the right thing to do. And it's not every medication you see online or you see in social media that you go and be looking for how to get it and start taking it. So I mean, you not cause problem for yourself. Yeah. And there are so many things, there are even some when you see online, those things never even manifest 100%. Like those medication feel never even dey like that. Or even though it dey, it never really, then the country never really say make they start to use am like that. Well. So make we dey guided, make we dey very guided on things when we dey see online, because so many people don't take so many things online and they know wetin they pass through. Not be my mouth you for here, and they know wetin they pass through. So if you dey take and you dey get luck, one day you may not have luck. So time don't finish. So I'll just say thank you, everybody. Thank you, those of you who ask question. Thank you so much. And those of you who they follow us, thank you so much. Thank you for following, and thank you for listening to our live. Those of you where they send us messages. Yes, there are some questions you send. It's not like we don't feel like answering them, because those questions are questions that it seems like, oh, this person really need to know. However, because of time, we may not be able to sit down, because with already say if we answer, you will send another one. So there's no need. So what you can do is to go to the hospital, or what you can do is to watch our videos. When you watch our videos, sometimes your question will be can actually be one of our video. or your question, we fit don't answer them for one of our videos. So we there from that one, you'd already get your answer. Dr. Fred.
Yeah, thank you so much, Dr. Israel. Thank you for watching this program now every Sunday by 8 p.m. to 9 p.m. Share this video, no come late. If you come late, you go miss. Invite your friends and your loved ones and make sure say all the advice we they give, you follow them. We will see you next week Sunday on this same platform. Like I always say, good life now waiting. Good life. Now sense. Take care
Yes.
and have a wonderful night. Bye-bye.